The first bandage that we'll be doing is a paw bandage, and I'm just quickly going to run through the layers that we'll use. Your primary layer will be a wound dressing. A secondary layer would consist of your stirrups, your padding layer, and your crepe, and your tertiary layer would be we're using elastoplast to finish off your bandage. So you'd start off with applying your appropriate wound dressing, and for the purposes of this video, we're not going to put on a wound dressing. Then you use cotton wool, little cotton wool pads between the toes, and between the foot pad and the toes. And you always need to remember to put a cotton wool pad on the dew claw as well. Then you apply your micropore stirrups that will extend about 15 centimeters beyond your bandage. We use a wooden tongue depressor to prevent them from sticking to each other, as you will be sticking one medially and laterally onto the side of them. And then you just stick them to each other like that. I'm just going to take this away. So then you start with your padding layer. You always work distally to proximally, and you do 50% overlaps with your padding layer. So for a paw bandage, we would apply the bandage just proximally to the carpus, and 2 layers of the bandage should be, padding layer should be appropriate for the purpose of a paw bandage. Right. Then always make sure that your bandage does extend to the edge of the 3rd and 4th digit, and that you can see them to make sure that you're not pronating or supinating your limb. Then you'll start with your crepe and leave a 1 centimeter cuff or collar at the end of your bandage. And you're going to do a 50% overlap with your crepe as well, for even distribution of pressure on your bandage. Then always remember you want another 1 centimeter cuff, the proximal end of your bandage, to prevent the crepe from forming a tourniquet. Once you're done with your crepe layer, you just secure it in place with a small piece of micropore. Then you will incorporate your stirrups by folding them up over your crepe. Stirrups help prevent your bandage from slipping down. Then you're going to take a nice pad of cotton wool, covering the bottom of your bandage over your toes. And then with your strips of elastoplast that you'll place a medial and lateral strip and then one just in the opposite direction. And you can stretch it just to secure it in place. Then your elastoplast, so this will be your final layer. Also start distally without putting too much tension. You do a 30% overlap with your elastoplast. And you'll finish your bandage off by applying the elastoplast over your cuff and attaching it to the hair of a patient, and then finish it off by attaching the end of the elastoplast onto elastoplast again. And that would be a pull bandage.